Hello, I'm Donna Reece. I'm a professor of medicine at the Princess Margaret Cancer Centre in Toronto, Canada. I'm also director of the program for multiple myeloma and related diseases. I'm here at the ASCO meeting presenting the results of weekly cyclophosphamide, bortezomib, and either prednisone or dexamethasone in relapsed or refractory myeloma. This is a retrospective study that we did to confirm findings that we published back in 2008 that weekly bortezomib could be given with oral cyclophosphamide and prednisone. In the 2008 paper, we only had 13 patients, so we decided to look at our experience outside of a clinical trial as we moved this regimen to treat a number of people with relapsed or refractory myeloma that we saw in our clinical practice. In this analysis, we looked at 98 patients. There were no eligibility criteria. These were literally all comers that we saw that required treatment. They had a median of 2 prior treatments. The majority had undergone a stem cell transplant. The majority had already had exposure to lenalidomide. We did not exclude for renal insufficiency, and 4 patients were on dialysis with a range in serum creatinine up to 900. We also did not exclude patients for blood count deficiencies, and a number of these patients went on trial if their myeloma was aggressive with low blood counts. The majority of these patients received intravenous bortezomib, but 25% were receiving subcutaneous drug as per our hospital policy, which changed in the fall of 2012. Our overall response rate was 68%, with 42% of patients having at least a very good partial remission. We were particularly gratified that the response rates were very much the same whether patients had had prior exposure to bortezomib or not. And the main finding was that the progression-free survival of this large population was 14.9 months. In this retrospective study, very few patients had to come off CyBor-D or CyBor-P due to toxicity. The incidence was 14%. One of the other findings that was notable is that there was no difference if patients received every other day prednisone, which was our policy until the ECOG trial defined the utility of weekly dexamethasone, at which times we switched over to weekly drug using this preparation. The bottom line was that outside a clinical trial, CyBor-D or P in the relapse setting remains a highly effective regimen with a progression-free survival of over a year, specifically 14.9 months, and can be delivered conveniently for patients in the outpatient setting.